Good afternoon, and thank you for joining us for today's webinar presented by the Sound Science Academy from Sonendo. Today, we are pleased to present Teledentistry, the virtual consultation for endodontists by Dr. Sonia Chopra. Dr. Sonia Chopra is a board-certified endodontist and founder of Valentine Endodontics in Charlotte, North Carolina. When she opened her practice in 2008, Dr. Chopra's goal was to help patients understand the why and how of their procedures. Dr. Chopra works with her local dental community, hosting seminars and learning events, and has recently launched an online education forum for general dentists worldwide, sharing knowledge on perfecting endodontic skills and focusing on thorough diagnoses, delivering compassionate solutions, and considering whole patient care. Dr. Chopra is also a director for the College of Diplomats of the American Board of Endodontics and serves on the CE committee of the American Association of Endodontists. It's our pleasure to warmly welcome Dr. Sonia Chopra. Dr. Chopra, take it away.
Thank you so much, and good evening, everybody, or good afternoon, depending on what time of day it is for you. Good day to everybody. I know that everyone has some extra free time right now, but I still just want to say thank you for allowing me this time to go over a topic that I think is really up and coming for not just endodontists, but also for general dentists out there, any type of dentist. I also want to recognize that I did make this presentation for endodontists, but I know that there's some general dentists or non-endodontists in the audience. So I'm trying to keep this a bit universal so that everyone can grab something from this presentation. Okay, so just a little more history about myself. Again, I'm Sonia Chopra. I graduated from the University of Maryland Dental School in 2003. I then did a GPR residency in Brooklyn, New York at the Long Island College Hospital. I worked in private practice in New York City for a few years after that, where I realized that endo really sang to my heart. So I went and completed an endodontic residency at Nova Southeastern University in 2008. And then I moved to Charlotte, North Carolina at the tanking of the economy, and I had to start my own practice because nobody would hire me. And so I want to say that we have lived through one recession, and if there's an impending one coming, I guarantee that we will live through another one, especially if we get creative with things like teledentistry that are going to help us really amp up our game. So a few disclosures about what I'm going to share with you today. I am a key opinion leader for Sonendo and Dentsply. Everything that you are going to hear from me today is strictly based on my opinions and my experiences and not the recommendations of Sonendo. And I'm also going to be sharing with you information that I have gotten directly from the ADA and TDO. What I'm going to cover today is just to go over exactly what telemedicine and teledentistry is. I want to show you how it can truly benefit your practice and your patients. And I am a systems girl, so I really want to show you how I've kind of looked at the flow of teledentistry. I never really incorporate anything into my practice unless I've seen what kind of impact it will have on the flow for me. I want to share with you how to conduct a virtual consultation and how we just need to be a little bit more creative in these times. And also, I want you to understand how to be compliant when you're doing a virtual consultation. Everybody is always concerned about billing, so we'll go over the insurance piece of it. And then also, how can we effectively communicate this with not only our patients, but our community, and how can we utilize this to our advantage? So what is telemedicine and teledentistry? Telemedicine refers to the practice of caring for our patients remotely when the provider and the patient are not physically present with each other. And nowadays we have a ton of technology that is going to help us kind of overcome this barrier that we're about to have. And also there's so many things that are HIPAA compliant. So let's utilize things like video conferencing tools like FaceTime and Zoom or Google Hangouts, and really let's see how it can benefit everybody that's involved. So I say that dentistry has kind of been thrust into the future, and I say that very lightly because teledentistry has really been around for a while. You can see that it's definitely a trending term on Google right now. If you look at the same time last year in 2019, the Google search for teledentistry was not very high, but March in 2020, it's definitely just shot up there. And so it's definitely a trending topic. It's very hot right now, and there's big reason why. But teledentistry started, in my opinion, a while back. So a few months ago, I actually got a little flyer on my desk at work, and it was for the 2nd annual North Carolina Teledentistry Summit. And I say 2nd annual because that means it's been here for longer than we realized. And teledentistry has been utilized for quite some time, mainly in the public health sector. So I actually went to this summit. I signed up a few months ago, but it took place on March 6th of this year. So it was really timely for me. And what I learned there is that we've been utilizing teledentistry in areas, there's certain counties in North Carolina where there's not one dentist. So what they've done is they've actually taken dental hygienists and put them out in the field where they do data collection. They collect the data, they get the x-rays, they get the probings, they look in the mouth and they collect all that. And then they take that data, they store it, and they forward it to a dentist that can then utilize that information to create a diagnosis and a treatment plan. So this is nothing new to the ADA, and so I'm not going to really go into this, what you see on this page. You're going to be able to use this website as a resource for you, but this is nothing new for the ADA. But they look at telehealth as not a specific service, but a collection of means to enhance care and education delivery. So some of these definitions that are on here, I'm going to talk about in a later slide, and that's right now. So when you were talking about teledentistry, there's a few definitions that we really need to understand. And first is the methodology. The methodology is important because you want to know, is the consultation happening via synchronous or an asynchronous method? And the difference between the two is that the synchronous is a live and simultaneous consultation. So that's what you are going to imagine when you're doing a FaceTime consult. There's a specific code for that, and that's D9995, as opposed to the asynchronous, which is the store and forward method, which is what they would use in the public health, where they would, a hygienist would go out and collect that data, store it, and then forward it to the dentist. And then they would use the code D9996. Okay, so synchronous and asynchronous are probably the two big definitions that we need to understand while utilizing teledentistry. You also need to understand the location and the originating site, which is the location of the patient, and the distant site, which is the location of the dentist. And those things also have to be documented in your case note, which we'll talk about in a little bit more in the presentation. You also need to identify the personnel. In our case, the patient presenter would be the patient, but oftentimes in the public health, it would have been the clinical assistant or the dental hygienist. The provider would be the dentist or the specialist. But if you're going to be creative within your own office, it doesn't necessarily have to be the dentist or the specialist. How can we utilize some of our other team members to really help amplify teledentistry within our practice? So what are some of the benefits to your practice and your patients? A lot of times when I'm speaking to people, I always listen for their objections. And one of the things that I've been hearing about teledentistry is that some people simply feel like they just don't need it. And I want people to have like a real open mind when it comes to it and think, what can we learn from now for the next time? And maybe they're expecting another wave of this to happen in the fall or the winter, which is supposedly going to be a little bit worse. That's what they say. So how can we set up our system now so that we don't have to deal with this again in the future? Some people think that this is temporary. Well, that's possible. And I hate to be the Debbie Downer, but we need to prep for the possibility of a possible next pandemic. And a lot of people hate to disrupt their flow, and that's kind of me. So I want to show you how there's little bits and pieces that you can utilize teledentistry to really amplify your care. How can your patients perceive the value? Well, your patients will feel like they're in your practice, but they're home, they're safe and they're comfortable. A lot of times, I think right now, what I'm hearing from my patients is they almost feel like a sense of abandonment, and that enhances their pain and their anxiety. Right now, more than ever, we need that sense of connection. So this allows us to stay connected with our patients and our patients to feel connected with us. We are all going to have that patient who is COVID positive and having endodontic symptoms. And what are we going to do for them? This may be the only thing that they have. So it's really great to get this system set up. What about the value for you and your practice and your team? Well, we may have certain new parameters that we may need to follow now. How can you maximize the impact when you're in your practice? So one thing that me and my team are brainstorming currently is, okay, if we need to minimize the time that our patients spend in our practice, not only for their safety, but for our safety, how can we utilize teledentistry to maybe minimize that time, that exposure time? So we've been thinking the patient can do all of their paperwork online. They can actually do the teledentistry part so that their consult, half of it is done via teledentistry and the other half is done in our office, therefore shrinking their appointment time. And maybe that time that we've gained by shrinking their appointment, we can utilize to really disinfecting our rooms properly. So there's a lot of ways to look at this than just being able to triage your patients from home. You can really try to maximize your schedule and your scheduling template. And another way to look at it is that, again, your front desk, now nobody has to touch anything at your front desk, because right now I know I'm wiping down everything on my front desk after they've used the pens to sign their consent form or to sign their credit card slip. Now your forms can be done at home, your payment can be done at home, everything can be done at home. The patient simply waits in their car until their operatory is ready. You call the patient upstairs, they come upstairs, they pass go, they bypass that front desk, they go into the operatory where they've maintained a proper social distance from other people and other patients in your office. The x-ray is taken, the cone beam is taken if it's necessary. The doctor comes in, does a quick exam, and then comes up with their diagnosis and treatment plan. And then your front office team can do a handoff in that operatory, which has to be cleaned out anyway. And the patient can make their payment and everything in that operatory. So I think if we have an open mind on how we're utilizing teledentistry, we can actually see that it's a gift. It's a gift that we just need to learn how to utilize and implement in our practice. And once you get this up and going, this is something that you want to share with your referring dentist. Maybe you want to share how you've set up your system, and maybe your referring dentist can set up their system. Or maybe they want to have peace of mind that their patients are going to be extra safe under your care. So again, I think that this is a big gift. What are your teledentistry options? Well, right now, HIPAA has had a temporary ease in enforcement, but I'm going to say if you're going to pick a system, try to be HIPAA compliant from day one. You don't want to use things like Facebook Live or Instagram Live. You really want to utilize things like Google Hangouts, Zoom, or Doxy.me, something that's already been known to be HIPAA compliant. TDO is what I use in my practice. That's my endodontic software, and they have made it super easy for me. So I'm going to show you my flow with TDO, and then you can extrapolate a lot of that to make it work for you. But some of the needs that I kind of went through with respect to the flow, I realized that you need an invitation and confirmation management. You need your patients to be able to sign forms. You need the capability of video conferencing. You need patient notes to be able to make that chart note. You need a way of getting payment. You need to be able to give the prescriptions and also be able to submit a claim. Now, I was really excited when TDO reached out to me and said, hey, we've already kind of addressed this need and we want to show you what we can implement. And I think that's great. And so what I'm going to show you is like version 1.0, and they're even working on that for version 2.0. To make it so that everything is inside TDO. Currently, TDO is going to use Google Hangouts, which is HIPAA compliant right now. So, but they're going to work on their own version, so everything is encompassed in TDO. Now, I do want to recognize that not everybody is an endodontist and using that software. So I do know that there is a way for you to do this outside of that software. And if you're going to ask me to find a solution, I want it to be as cheap as possible. Luckily, TDO is free, but this is probably the next cheapest option that you can implement. I have interviewed some other people. There's a ton of companies right now that are trying to launch their products or just get more people on their platform, but they are all going to have like a monthly fee. So most of what you see here will address those same needs that I talked about when I discussed it with TDO. The only thing that this is really missing is your claim submission. So that's going to be still done through your software. And also your payment won't get integrated immediately. You would have to input that manually into your software, but at least you can collect payment with this method. So Calendly.com is a great platform. I like it because it's customizable. If you don't have a front office team member, this can be very automated. You can make a 20-minute consult, you can make a 30-minute consult, whatever you want. So you can really customize it. And if you want to just do this from maybe 3 to 5 o'clock every day because you're in clinic from 9 to 3, but 3 to 5 you're doing virtual consults, you can totally customize it. FormStack is something that I've never used before, but it is a way to use forms. But if you have something like even yappy.com, I'm sure you can send a link to your patients so that they can do their forms at home. Zoom and Doxy.me, those are going to be your video conferencing component. Zoom integrates really well with Calendly so that when you make the appointment, that Zoom invitation is actually automatically generated, and both the doctor and the patient get that. So there's also automations in here once you get it set up. It's a little bit of an effort to get it set up, but once it's set up, it's kind of one and done, and you can always go and change like your available times or whatever later on if you want to. As far as payment, I personally like Stripe. You're going to get like a 2.7 or a 2.9% merchant fee on both, one or the other. I think it's somewhere on there. Stripe integrates well with Zoom and with Calendly, and so this portion can either be before the patient is allowed to make an appointment, or you can do it after the conference is done. So know that there's another flow that you can have even if you don't have TDO. So I'm going to go over the steps in my office and how this gets done. I personally want to still utilize my front office. I don't want to deal with collecting insurance and address and email and all that stuff, or payment information. I prefer my front office staff to do that. So first, the patient calls the office and the staff collects that information. At this point, if you want to take payment, you can, or you can wait to do that later. In TDO, we now have a new tag that says when you're making an appointment that it's a TDO live consult. What this does is that there's an automation there, and it generates the virtual consult in Google Hangouts, and the patient is given an email. Once the patient gets that email, they're going to confirm that appointment, and that next automation that's set up sends an email to the doctor. So now both the doctor and the patient have the invitation to the Google Hangout. In the meantime, the patient can complete and sign all of their forms using their secure patient portal, and all of this is stored in their chart. The virtual consult is then done by the doctor and the patient. And with most of these platforms, you can actually record the call and then store that in your patient's chart. And then you're going to want to record the notes, and I'm going to show you what is necessary in your note to be fully compliant, and that'll go in your patient record. TDO is great because there's also electronic prescriptions, and I've been using that for well over a year, and then that can go directly to the pharmacy, and that's great with narcotics as well. And then the front desk will take over again, and they'll make the emergency appointment, or maybe it's a wait list appointment. Maybe they don't need to be seen right this second. The patient can pay via the patient portal, and then within TDO, once the patient uses that portal, it automatically posts that payment into the patient's ledger. So again, another layer of automation that I don't need to get involved in. And of course, then the insurance is billed, and that's handled with the front office. So if you want to watch a little flow, a little video, I'm going to share that with you now. So that basically addresses the flow, and that flow can be utilized within any platform. But again, just to kind of compare the two, when you're utilizing TDO, I think it's kind of all encompassing. I love the fact that both ways you can record that video so that consult can be stored in the patient's chart. TDO will be using Google Hangouts, and I love the fact that I can still use my front office staff in order to not disrupt my flow entirely. There's less manual entries that need to be made with the TDO side, but if you don't mind just manually entering the patient's payment and the insurance claim, then that's totally fine. So how do you conduct a virtual consultation? First and foremost, you're going to need an informed consent, specifically for your teledentistry consult. And so you can find some sample language on the ADA website to make your own informed consent. We just created ours and we made sure that it lives inside our infograbber in TDO so that we can automatically send it to patients. But one thing we wanted to make sure that it included was not only during the pandemic, but we also want patients to understand that this may be a part of the way that we do our consultations moving forward in our practice. And so we've made sure that our verbiage covers both scenarios. So if you want to do that, then I would highly recommend incorporating that. So when we're doing our virtual consult, we have to get a little bit creative. I know all of us are really good at almost just listening to our patients' tooth stories and understanding what they need right off the bat. But I do feel like this extra layer of visualization is really going to help. So the steps that we need to kind of think differently are our visual assessment, our palpation, percussion, bite stick. And now our heat and cold testing are going to be a little bit more verbal. My heat testing's always been more verbal, but now cold testing too. But of course, listening is going to be the best gift that we can give our patients. So before we would use our microscope, so we had an assistant, and we would do our visual assessment this way. Now our patients are going to have to take a selfie and send us that selfie, and hopefully they do that in step one when your front office is collecting the data. Also, if you're referring dentists, and for those general dentists that are out there, even if you don't have a recent radiograph, anything from an FMX that even was 6 months ago, if that's sent to us, will give us a better idea of what's going on in the patient's mouth. And then you can utilize this and share your screen during that video conference, so you can really still properly educate our patients. Instead of you being the one palpating, now your patient's going to palpate. And luckily with video conferencing, you can still see if they wince their eyes, or you can still see their facial expression. So really utilize it because it can be really helpful. Your percussion test is no longer with the back end of a mirror, but rather a chopstick. That same chopstick can be now used as your bite stick as well. And you may have to kind of show them yourself how to do it so that they can copy you and kind of follow along with you as the initiator. Heat test, like I said, I usually just ask people about heat instead of doing a heat test, but maybe they're going to report to you that they can't drink their morning coffee or their ice water. So once that consultation is done, you need to be compliant with your note. So you have to have a few things that you incorporate into this, this note that you put in the patient's chart. Number one, you have to include the location. So the originating site is important. You need to say the location of the patient. If it's the patient's home address, you just say patient address on file. And then the distance site would be the location of you or your office team member. And if it's you doing it from your home and you don't want your home address put in the patient's chart, just say Dr. Chopra's home address on file. And if you're at the office, just list your office address. Depending on the personnel, you want to, again, include your patient presenter and the provider. The patient presenter is usually the patient, and the provider can be the dentist, specialist, or even clinical team member or front office team member. And maybe you want to put their name as well. You also want to identify the methodology. So describe the way you're communicating with the patient. You're going to identify if it's a synchronous live interaction or if it's an asynchronous way of messaging. and you're going to describe the technology used. So if you are using TDO, you are going to say that it's via Google Hangout. If you're doing this just during the pandemic, then you want to make sure that you're putting your screening questions in here as well. So are the patients still traveling? Have they really practiced proper social distancing? Have they been exposed to anybody at work? All those questions should also be in your note. As always, identify your patient's chief complaint and then document any next steps. Were there any prescriptions given? Is there an appointment that's needed right away, or can they be appointed to maybe after the shelter in place has been lifted? Now, how about submitting a claim, and what other legal considerations are there? And also, I want to just give you a few resources that I have found really handy. So when you're submitting your claim, you want to make sure that you're submitting 2 codes. One will be one of your oral evaluation codes, and the other one will be your teledentistry code. They both go on the same claim. So you're typically going to be using the D0140, which is your limited, or you could use a D0170, which is your reevaluation of an established patient, or the D0171 if it's a post-op visit of that established patient. And then you also want to add on to that one code. You want to add whether it's a synchronous or an asynchronous consultation. So typically what you're going to submit is the D0140 and the D9995. Okay, so make sure both of these codes get submitted on your claim, and then you'll be fully set. Some resources that I found that were really helpful you'll find on the ADA website. They are also, there's one strictly for COVID-19 that they are updating weekly. So if you have any questions, these ones are huge. I have talked to several of my colleagues in other states, and some states are not allowing teledentistry. The last I talked to somebody in Texas and I believe in Maine, they both were not allowed to do teledentistry. So make sure that you check for your state laws, and this I found to be a really great resource. Now, how about effective communication? I always say that if you have something that you've implemented in your practice and you want people to know about it, you need to tell them about it. So maybe during this time, you actually have a pop-up on your website, or you're just updating your website so people have information. But a nice pop-up that says, hey, we have teledentistry consults available would be really great. This is a great time to refine the words and the copy on your website, and always make sure that it's mobile friendly. Now is not the time to go dark. Now is actually the time to make sure people are finding you. And it's really a nice time to develop content that is very relevant for now. So for example, we made a blog that was basically about all the precautions that we've been taking for our patients with respect to COVID-19 and how they can feel safe. So not only is this an educational piece for your patients, but it's also, now remember I said teledentistry was trending. Now you actually can, get those keywords on your website because you created a blog for it. So it's kind of a twofold thing that you can do. So I highly recommend that you also have a website strategy behind all of this. Really inform your patients, really inform your peers. There's a way to even market, okay? I think that right now is, what I'm seeing is that a lot of the specialists look and are basically being leaders within their community. And it's really important to stay in close communication with referrals. Let them know what you're doing. And again, if you find a system that works for you, that's benefiting you and your patient in your office, maybe you can share that information and help them get up to speed as well, and help them implement their system. We ended up getting our N95 masks a little bit early, and so we knew that a bunch of our peers had nothing, and they wanted to help triage their patients. So we wanted to be kind of normal. We wanted things to feel a little bit normal, so we made Easter baskets and we stuffed them with candy and N95 masks. And we wanted each doctor and at least one assistant to have some protection for themselves while they were helping triage patients and keeping people out of the emergency room. Also, be present on social media and even paid media. Maybe now's not the time to really do so much Facebook ads, but don't go in the dark. Still be present digitally. This is your way to talk to your community and let them know that A, you're okay, that B, you're open, and that you're still seeing patients, but more importantly, you're being safe and doing it at the same time. If you haven't created your Facebook pixel yet, I highly recommend that you do that. You could probably Google it at this point and implement it yourself and not even need anybody else's help. So there's lots of little things that we can be doing within our practice right now with a little extra downtime. So this was just what we did for our referring offices. We gave them something sweet to make them smile. We stuffed it in with some N95 masks, and this was a mask that I was trying on. It was actually donated by one of our emergency patients who was really just really grateful that we were able to help him out. And so he works for the city and gave us some extra masks. But they can see how we're trying to keep safe, and they really like that extra information. So in my opinion, I think teledentistry is here to stay. I think that we need to embrace it, and we just need to go full throttle. I really want you to think about how it can elevate your practice and how it can put time back into your schedule, especially if we have to follow certain social distancing laws. So be really creative with your flow and see how it can really help you. Make sure you do a dry run with somebody in your office. You never want to go to an empty virtual room or your patient to end up in an empty virtual room. So make sure you test it out a few times, and make sure you tell your community that you're doing it, and make sure you share with your community any relevant information that you're providing in your office, and just tell everybody about it. But of course, check with your state laws to make sure everything you're doing is allowed in your state. If you guys have any questions, feel free to reach out to me. You can follow me on Instagram at Sonia Chopra DDS. That's Sonia with an I. You can email me at sonia@soniachopradds.com as well.